So in dogs, it's super common to have a CCL injury. So a CCL in a dog is the doggy version of an ACL in a human. So the CCL is a ligament. It's in the dog's knee. Seal, come here. Okay, so it's inside the knee joint, and it prevents the knee from hyperextending. It prevents the knee from internally rotating, which means turning inward, and it prevents the dog's tibia, which is basically like the shin bone, from moving too far forward on the dog's femur bone, the thigh bone. There, okay? So his is intact and his knee is nice and tight. So it's a super common injury that oftentimes occurs when dogs are chasing something, a squirrel, a ball, or if they're running and doing a sharp turn. A lot of times it happens as right on the spot, so the owner says dog's running, all of a sudden the dog yelps and the dog comes back and it's three-legged. Other cases, the dog has a partial tear initially. Zeal, come here. Zeal's mugging the videographer. Lie down. Lie down. Sometimes it's a partial tear and occurs slowly over time. In either event, typically the dog is severely limping on the hind end. Sometimes they're holding the leg up. So if you go to your vet or an orthopedist and you get that diagnosis, you have several options. One option is surgery. So there are multiple surgeries which you can look up online, or you can discuss with your vet, an orthopedist, or a rehab specialist, which might be the best fit for your dog. Some are more invasive than others. In all cases, they are attempting to replace what the ACL did, because they can't repair it. They can't sew it back together, so they somehow use pins, plates, depending on the surgery, to help hold that joint in place. Another option is what we call conservative rehab. What does that mean? It basically means physical therapy on the leg with no surgery. Again, in physical therapy, we are not going to fix the ACL. What we are going to do is help for scar tissue to form around the joint to help support it, and we are going to build up the muscles in that leg so that they will also help support the knee. Long-term outcomes are actually relatively similar, whether you have surgery and do rehab or whether you just do rehab without surgery. There are a number of factors that come into play. Your dog's age, your dog's activity level, your dog's size. So these are all factors that you want to consider. And again, you would want to talk to someone about that, the pros and cons of surgery versus not having surgery, i.e. conservative. And if you decide to go with surgery, choosing the one that is best for your individual dog, because two dogs are the same. If you do decide to have surgery, we do recommend physical therapy afterwards, not just to help the surgical leg recover, but we also want to save the leg that is not injured, because so many times when dogs tear an ACL in one leg, it's only a matter of time before they tear the ACL in the second leg. Many times that can be prevented, because if you fully rehab the injured leg, then it will bear its own weight and it will decrease the amount of compensation your dog does with the healthy leg. So whether you have surgery or not, our goal here is not just to help the injured leg recover, but also a huge goal is to do everything we can to help you save the other leg from tearing the ACL in that leg as well. So there you go. Please feel free to email us or call us if you have any questions, and we'd be happy to help.